Welcome to the Beyond Fear podcast. I'm Jen, and today I have with me Ed. So, Ed, if you'd like to introduce yourself.
Hi, I'm Ed. I'm a second year physiotherapy student. I'm a mature student. I'm a bit older. I had a kind of life before that sort of led me here, which I don't know. Maybe we'll talk about. Maybe we won't. Let's see.
Yeah.
And happy to be here chatting with Jen.
Okay, and today we are going to be talking about the comparison between sports injury rehabilitation and physiotherapy as two different routes into the profession. So today's conversation is about helping prospective students understand the differences between the sports injury rehabilitation and physiotherapy pathways. It's not linked to any university, and we're not speaking on behalf of any institution. We're simply sharing our own experiences as students to help you think about what route might suit you for your goals, your interests, and preferred way of working. So bearing that in mind, we are going to be discussing the 2 degrees, future prospects, sort of what modules and placements look like without naming places specifically. Although I think it's safe to say the NHS would be mentioned for physiotherapy. Yeah, so Ed, tell us a little bit more about your background then.
Yeah, all right. This is my second time doing a degree, my second time doing a bachelor's degree. Sort of years ago, I actually studied drama and performance, and I had a kind of life working in theatre, and I kind of I had a niche which was sort of interested in movement in the body and movement in the body in that performance context, and sort of through my engagement in that, I became more interested in some of the kind of therapeutic advantages or benefits of, having this kind of movement focus. And, lots of other stuff kind of happened in my life. COVID happened. And I had a kind of point of like, I kind of want to do something different or move into something else. And then I saw that there was this opportunity to study physiotherapy and access to funding through the NHS. And that it was going to be, I can say that we're in Wales.
Yeah, go on. We'll have that one.
And
it limits it down a bit, but yeah.
Yeah. And, I'm originally, I moved around a bit and I'd been sort of around the UK and other places, but I wanted to come back to Wales. And so it seemed like this great opportunity to kind of, pursue this interest of mine and kind of put myself back in another place and sort of do some other things with my life. And so, so I applied for the course and managed to get myself onto it, and here I am.
Yeah. So a bit of a difference from starting off in art. Yeah. So I'll quickly fill people in on me. So I'm doing sports injury rehabilitation, also year 2. My background was graphic design, so creative again. And I injured myself. I got into sport at 25. I injured myself in a pretty nasty roller skating collision, and ended up having surgery on my knee, getting involved in triathlon, and then realising basically injuries suck. So I wanted to do physiotherapy, applied, got put on a waiting list, and if anyone knows me, they'll know I've got a little bit of an ego, and I don't get put on waiting lists. So I did what any grown-up would do. Threw my toys out my pram and told them to take me off the waiting list. I don't care. And then I got a notification about Sports Injury Rehab, and I was like, that would actually suit me better. And for the record, I'm in the right place for me. So that's what today's episode is going to be about, is sort of the kind of comparison between the two, but not in this one's better than the other one. We're hopefully going to leave that to you to decide, for the listener to decide for which one is better for you.
Yeah, more appropriate.
More appropriate,
you, could say.
Yeah. I don't like the word better.
Being, what does that mean?
Yeah, what does better mean?
Better for what?
Well, that's just it.
Yeah.
And I think that's just it, is there's a lot of times we have pros and cons and we make lists. So hopefully we're going to help from a student sort of point of view, both mature learners. So starting off with... shall we go on to sort of like modules? Obviously, every degree at different universities is going to have different modules. I'm assuming that's the same for physiotherapy, and it's each university is going to have different ones. So do you want to tell us a little bit like what sort of thing you've covered in year 1 and 2?
Yeah. So I had some surprises myself when I arrived on the course. You know, it's sort of like, oh, I probably could have looked into this a bit more closely before
me too.
got here. But I think that is true of quite a few people on the course. And so, yeah, there were sort of areas of, you know, this sort of research around this now that, you know, people think physio is what they've seen physio as. So some people think it's the guy standing on the side of a sport pitch.
Right.
But, you know, if you had a family member who's had a certain healthcare condition and they've had an interaction with physios, then that's what a physio is to them. And sort of I had a perception of musculoskeletal physiotherapy, and then that's what kind of physio was. But I learned, you know, because I am answering your question in my own roundabout way.
No, it's fine.
That actually there, you know, 3 broad overlapping general categories of physiotherapy. And so, you know, musculoskeletal being one of them, but then neurological physiotherapy, so any kind of neurological cause, should we say, that might impact how you move. And then respiratory physiotherapy, which was like a total surprise to me.
I wouldn't know much about that now.
Yeah, I mean, well, I didn't know it existed until I was suddenly being told to revise my lung anatomy. And so those are the kind of 3 broad areas of physiotherapy.
Yeah. So can I just interrupt, just for the listeners, in case you're not aware? So musculoskeletal would be the sort of bones, fractures, rehabilitating limbs. So it's basically muscle structure, bone structure, ligaments, soft tissue. Neuro would be more, I know you said about conditions being quite general, more like sort of stroke, paralysis. Anything you'd sort of add on to that? I mean, obviously there's a whole list of conditions, but
Parkinson's, MS, multiple sclerosis, and I think those are like the most common. You know, stroke, Parkinson's, multiple sclerosis, and then there's all sorts of conditions you might splinter off from that which you're not going to see. They're just less common, but it's good to know about. And I guess in general. So yeah, really good. Thanks for the clarification for myself as well. You know, like, so anytime the brain is involved, really,
it's neuro.
It's neuro. So, you know,
it's the brain, the nervous system. You've got to retrain the brain and the neuro pathways, which actually is done in musculoskeletal as well. But but it's more focused on that, and like sort of expectations are going to be slightly different as well with sort of patients.
It's often the source of the difference in function, should we say. So, you know, in musculoskeletal, there's still nerves that are involved. And you may have an issue where a nerve is impacted, but generally it's not going to be in the brain. It might be something about the surrounding structures of the nerves to do with the muscle and the bone that has then impacted that nerve, which is what makes it musculoskeletal versus neurological.
And then cardiovascular sort of rehabilitation. Again, I don't know a lot about that myself, but I'm guessing it's a lot to do with like heart attacks and heart surgery.
So, no.
Okay.
Yes, and, you know.
I got a yes. I'm taking that a yes as I got it right. I got half a point.
So there's something called pulmonary rehab, which might be appropriate for people with more specific cardiovascular issues, but it's really the respiratory side of it. So anything to do with that's going to affect how you breathe and affect the lungs. So chronic bronchitis or emphysema, or, you know, which would be under the category of COPD or chronic obstructive pulmonary disease. And things that affect how you breathe, and that there's a whole, which it kind of blew my mind. Arriving here and learning about it, it's a whole, you know, how you breathe and breathing techniques in order to clear, you know, excess stuff in the lungs that you don't want there that can be removed. A non-invasive movement based either through breathing or through a manual technique.
Yeah.
Physiotherapy that can help to impact that. And
yeah.
Yeah.
So we didn't discuss modules, but as a key sort of contrast, I'll just is like physiotherapy works on those three. So you tend to specialize at some point in each of the three.
So really briefly, just to actually answer the question. So that in the first year, we look predominantly at the assessment of those things. So what do you do when someone presents in front of you and says, I'm having a problem with this?
Right.
How do I assess that person to just, try and work out what might be happening with them? And then in the second year, we start to focus much more on treatment options and how do we manage those things with them, with some other stuff kind of around that, which we can talk about.
Yeah. Well, the sports injury rehabilitation side is literally just musculoskeletal. I mean, I say that in fairness, like, as I say, there is like an element of neuro stuff that goes in. So, it's not like you're ignoring the brain and the nervous system in the MSK, musculoskeletal. And we also do like VO2 max and some sporty stuff. So that kind of similar, I guess, in that is we do need to learn about the cardiovascular system and stuff like that. But obviously it's the difference between sports injury and physio really is that physio has those three elements and sports injury are literally just the musculoskeletal in the clinic or on the pitch side. So it tends to be one of those two things. So modules. Our modules were very similar. So the first year was about sort of assessing. So we had assessment modules. We did professional practice where we're learning to work as IDTs and MDTs and multidisciplinary teams. So how do we all work together nicely and play together, children? And then we also did a massage module. So soft tissue module where that was it was quite good because once the board's all approved, we can actually go out and practice massage. So that was quite a key one because it helps boost income revenue for year 2 and 3 and onwards. And then, the other module I wanted to mention, well, we've done treatments for year 2. So year 2 has been treatments, research, which I know we're going to discuss. Research.
Which is our common
common thing we like. We were both in research together. So we did it. Okay, no, we're going to get too specific. So the research modules we do as healthcare. So all the healthcare courses are put together. So obviously that's sort of where, well, I met Ed at a research evening, but we had met previously. We were in the same class, funny enough. We just all segregated into our own little groups and no one spoke.
So I guess that it's another module or another pathway through the degree. So we've got those profession-specific kind of things that we focus on, the things you'll need to learn to do this job later. And then you've got this degree-specific, so what makes this then a university degree as opposed to an apprenticeship, for example. And I think that research element, this is where my past life kind of rears its head a little bit. I think that's where that research element sits. That's what makes this academic.
Yeah. I did an HND in graphic design 20 years ago. Gosh, it's sad, isn't it? And how did we get old? And so when I did that, we didn't do any research. We probably did, and we just did it slightly different. So I never looked for studies to cite and stuff like that. It wasn't like that. But I really enjoyed the research. I've really enjoyed learning about research, and I think that's the route that I'm sort of going to head down when I sort of finish, is going down like the more sort of research side of it than actually practicing in clinics, which is what surprised me actually. Because when I signed up, I was thinking, not necessarily pitch side. I sort of saw myself in a clinic, like wiggling people around, giving them exercises, telling them to go on their day. And I fixed someone. And then I started this course and realised, wow, that's wrong. It does not work that way. So it's been really interesting learning about the psychology side and obviously like the research side behind. I quite like psychology and behaviour change, but even just the research around like random controlled trials where people are moving differently or certain ways and they're outperforming other people, and like why. And treatments, oh my gosh, treatment research, we could be here all day talking about placebos. Well, I did a whole podcast on placebos with a psychiatrist the other week. So yeah, so I found it really interesting. So when you say that you sort of, when you wanted to become, do the physio, you said you sort of, did you see yourself in a clinic?
Yeah, I guess. So I remember, so as part of there was a company I was working with as a performer, and I was having pain in I was having pain in my neck and back. I was really concerned about it. And through the company I was working with, sort of through friends of a friends, they knew a physiotherapist, and were like, "Hey, we can sort you out with an assessment, with a session with this guy," and it was incredibly effective. Like it was, I had this session, and in that one session, I had a new experience of my symptoms. I had a new perception of what was happening to me, and that alone seemed to be really therapeutic. That enough on its own was really useful. And I guess that's what I kind of imagined as physio then. I was like, oh, okay, so that's probably what I'd be doing. And I remember talking to him a little bit about it. And yeah, kind of, so I was very MSK, musculoskeletal, minded, but then also recognizing that there's a kind of spectrum of that. So he had entered the profession through circus performers.
Oh, right.
So,
okay.
Yeah, so he'd been working with circus performers,
Right.
and then had kind of gone on a journey through his life, and then now was living where he lived, but working with a much older population, with a different kind of things that impacted how they could move, and so it was a totally different world of what physio was again. And so I had a sense of that there was this broad world of what that might look like, but still very much in the, people are going to have something, they're going to have pain in a limb somewhere, and then I'm going to try and
fix it.
Yeah, fix it.
I'm gonna fix
that's
it.
in the inverted commas. So and I think like in a clinic was where my mind was, how that might take place, and then very quickly it was like, oh, there's like a million places.
Yeah. We'll go on to job opportunities in a bit. If we maybe go on to like placement, and so I'm guessing your placements have all been NHS.
Yes, and I believe they all will be. So it's if people can work out where it might be from other bits of information, that's good for them. But I think it's kind of part of the funding and how that happens for being on the course, and so the idea being that we're going to be fed eventually into the NHS, and so it makes sense. Our placements take place there. I've only had one, so thinking about that's the other, harking back to the modules. That's the other big part of each year is you'll have a certain amount of time on placement or working placement. They call it something else now, I can't remember.
Can you tell us what sort of the placement blocks have looked like? Because I believe you do them in blocks, don't you, in year 1, 2, and 3?
So in the first year, we have a 4-week, a single 4-week placement. In our second year, we have a single 7-week placement, which I'm starting on Monday.
Okay, fantastic.
And then in the third year, I think we have 2 placements. One's 10 weeks and one's 12 weeks, I believe. So then you do most of your kind of classroom learning in the first 2 years, and then like a lot of clinical experience in the final year.
And just to be clear, I'm assuming unpaid placements.
Yeah.
And you might have to pay parking, or do you claim stuff back?
So if you are funded through the NHS, then they will cover any additional travel needs that you have outside of what you would normally do for getting to university. So like, say you normally have a half hour drive to get to university, they won't, if you have a half hour drive to your placement, they won't cover that. But if you need to travel outside of that or travel any further, or you might have to go and stay somewhere, then they will cover that if you're on an NHS funded course, which is what they're doing for me. I'm going to be.
Is that like with the bursary?
Yes, exactly.
And the bursaries, you currently, obviously things might change if you're listening to this somewhere down the line. I'm guessing that's you're committing to working 2 years for the NHS?
Yes.
Yeah, afterwards.
Yeah, exactly.
Yeah.
And then that's it. They cover it. They cover you.
Yeah, they cover your tuition fees and they help with the placements.
Yes. Yeah. And they'll give you a little bit towards your kind of living expense as well, which is means tested, depending on your circumstances.
Yeah.
And then I believe something I didn't know until I was kind of here is you can get your maintenance loan.
Yeah, on top.
On top of that.
Yeah.
And if you're doing an NHS funded course, you don't have restrictions if you've done a degree previously. So I'd had funding previously, and I thought, oh, that's it. I've used my allocation for that. But that's not the case. If you're then going to work in the NHS, they're like, oh, no, we can give you.
So I was in a sort of similar boat, having done the HND. I'd had funding, which was really annoying because I think my student loan, because it was like 20 years ago, I thought my student loan was massive. It was like $5,000. That's like half a year. Yeah. But because of that $5,000, I couldn't get funding for sports injury rehabilitation because it's not part. There are NHS jobs and there are more coming through for sports injury rehabilitation within the NHS, but because there's no bursary that covers sports injury, my route was basically physio or nothing. So obviously me spitting my dummy out, it kind of scuppered me a little bit. But maybe
got you on a more appropriate course for what you were interested in.
Yeah. Well, we'll probably discuss that in a minute. But So I ended up having, so I was allowed 1 year covered for tuition fees. I got the maintenance loan for year 1 and 2 and used the maintenance loan to pay my tuition fees. So everyone else is like, yeah, we got my maintenance loan. You know, like, I'm the only mature student on my course as well. So on my year group. So I'm surrounded by 18, 19, 20-year-olds. It's fantastic. and so they get their maintenance loans. They're very happy. I get my maintenance loan and I hold it until literally I've had the 2 reminders to pay my fees, and then I pay my fees, and then I'm sad because I'm poor again. But my 3rd year they will cover the tuition fees and give me my maintenance loan. So I'm happy next year. It'll make things a lot easier. But then we don't have the bursary. We don't, obviously when we qualify, we can go wherever that will take us. So that'll probably, as I say, we'll discuss that all in a bit about like sort of what next.
Yeah.
So your placement and blocks. So you do the blocks. We do. Now every degree is going to be different with sports injury as well, but we have like an on-site clinic. So we have placements like in year 1 and year 2, it's like every other week. We'll have an afternoon or a morning every other week at a set time where we have members of the public coming in and they'll be assessed and treated, given a plan, whatever that looks like. So that all happens and then we book them back in and we see them again. Or it could just be massage, so people can just come in and book in for a massage. So we have the on-site sort of internal placement. We also have other opportunities. So there is a sports group, we'll name it that, and in the university, we can go and help out with like lactate threshold and different sports events testing and stuff, and that can count as placement hours. We also in year 1's observational, year 2 we do we're more hands-on in the clinic, but we also have external placements. So, and these can be sourced by the university, different contacts within the community in clinics. There is one within the NHS at the minute somebody's doing. I sourced my own with an education provider that trains personal trainers to do not like physio, but some passive testing and stuff like that safely in gyms. So that's where my external placement's been. You get football clubs, rugby clubs, ice hockey, different, so it's very varied, but it's very much you're out in the community in sports or private clinics or education. I know like the accrediting body sort of thing, like probably not the what is it, governing body. I don't know. Somebody that tells us what to do. They sort of said like, education, so teaching, research, armed forces, stuff like that. So there's lots of sort of different opportunities sort of that can be counted as placement, but obviously it's up to the university as to whether they can negotiate those contacts and insurances and things like that. And yeah, I'm like, we're quite lucky here, naming no names, because we can, we can source our own, and providing obviously all the paperwork's there in place, we can get a placement with a contact we have wherever in the country, possibly abroad. There was talk of getting placements abroad.
Oh, wow.
It's like, that'd be epic. It's like Monaco Football Club. Come on. Shout out to Monaco Football Club. If you need someone next year, just send me a buzz. No, it'll be all right. I like Monaco. They got good Starbucks. So what have we done? We've done modules. We've done placements. Have you enjoyed your placements?
Yes. Well, it was interesting. So I think, just to sort of feed into what you're saying there. Yeah. So our where we might be on placement, it could be quite different. So thinking about those kind of three areas of physio, I mentioned like you might broadly be in a category like that. So you might go to a musculoskeletal placement, which is what my next one will be, which I'm really looking forward to. Yeah. Which will be kind of a little bit what I imagined physio to be. You're sort of in a kind of clinic and people are going to turn up and say, I've got an issue with X, Y, or Z. And you can do an assessment and see what you can give them to help with that. But my first one was in an acute medical unit in a hospital, and I sort of asked for it. I think in the cohort I was in was quite a lot of people that had experience, either as carers or as technical instructors, working in clinical environments, and I didn't have any clinical experience, and I kind of said, expose me to that. I'd like to see what that's like. And they, I was kind of thrown in the deep end with that. And so, I was in the hospital on the hospital wards, and, assessing people's function, a level of, can this person safely get home? And through from the perspective of how they're moving and how they're walking and how they're able to get themselves about, which I always think about in terms of how it might be different to sports rehab, because I guess to some extent you're always thinking about, okay, so when do they get back to sport? Yeah. Whereas this might be, can we get them out of this chair? Yeah. Which was. Yeah.
Sports, return to sport. We talk about return to sport a lot on the course. We do a lot of work with the general population. So although obviously the impression is that we're working all at elite sports level, like one of our modules last year was physical activity for health. And that was literally about getting the public moving and, active. So quite a lot of the people we see sort of in clinic, again, it's the general population. So very similar to yourself. How do we help this lady being able to reach the pan off the top shelf? Or, how do we, we do get a lot of sort of like the sort of amateur sports where sort of like almost like chronic tightness, things like that, back pain. Oh, yeah, back pain all the time. So it is very, although you sort of think sports injury rehab would be literally dealing with sporty people, you're dealing with anyone, but it is just literally the MSK side. So, and it's quite funny because we went to a conference last year and a few people would sort of say, oh, what course are you doing? And it was like a healthcare conference and they sort of say sports injury rehab. And they start talking about sports science, straight away, sports science. And it's like, that's not what we do, So there is a frustration, I think, on my part. I don't know if it's widespread in that people don't really understand what sports injury rehabilitation is. I think, like you say, people have this perspective of physiotherapy and what physiotherapy is, and it might not necessarily include the expanse of what the course or the thing. But I think as well, it's it's difficult because, I mean, we'll get on, well, we might as well talk about it now, is physiotherapy is a protected term. So not, only people that have qualified with a degree can call themselves physiotherapists. Sports injury, we won't get onto that. There is terminology you can and can't use, or how you use it, I can't quite remember. But like once I'm qualified as sports injury rehabilitation, although it's the physiotherapy, so the musculoskeletal side of sort of physiotherapy is probably quite accurate. It isn't, and it's like you can't use that term whatsoever. So we've had quite a few people in the clinic, and you'll hear them, or they'll be messaging, or they'll contact you and say, "Oh, I need to come in for my physio this week," and it's like technically incorrect. And even like a lady I know, so she was a personal trainer and a biomechanics coach, and I don't know what went on, but she did like a big post at one point, sort of saying, I have never claimed to be a physiotherapist once, So it's quite a big thing. It's like once. I liked the idea of being a physio, and I when I did the sports injury rehabilitation, I realised like you can do the masters in physio, so you can apply. Like I could apply once at the end of this, and that was the initial plan, was to apply and do the masters in physiotherapy. 1,000 hours placements in the NHS over 2 years. That's a lot. Unpaid, I'm guessing. I'm assuming. I don't know. So I could do that and get the title physiotherapist. Is it worth it? So that's another question. I don't know. If that's one you want to answer.
Well, I mean, I know, I don't know.
We'll find out.
Have the title
We can discuss that in 5 years.
But yeah, I think it's a good question. Because like, is it? What does that title give you? I don't really know the answer to that at this point. Maybe someone who's got more experience as a physiotherapist.
I think from what I'm told, the doors are opening more for sports injury rehabilitation. And like in England, it's a bit more of a bigger thing. Like sports injury rehabilitators are included in a lot more things than, job applications or whatever. In Wales, I believe, is a little bit slower to catch up. But please don't quote me on that. Please don't cite Gen 2026 on that. But yeah, so it's, and I think especially like elite sports, I believe some football clubs need a actual physiotherapist title for some roles, or they need at least one. I'm not entirely sure.
Which seems strange to me from my experience of arriving on this course, where you have people that have kind of turned up thinking that it might be more like sports injury rehab, I guess. And then it's, there's a little bit of kind of managing expectation of going, well, that might be a path that you could follow from this, but actually it's this whole other thing.
And you've got to do everything, I'm guessing.
Yeah, exactly. And then I think after that there's, so once you've sort of got that tick to say, okay, you can call yourself a physiotherapist now, I think you then have to kind of identify your areas of practice and regularly sort of maintain
with CPDs.
Yeah, and to be able to say like, oh, I'm a musculoskeletal physiotherapist. Like, that is my area of practice, or maybe it's not. And maybe it's something else. Someone I was talking to was saying, talking really specifically about that. I think they'd worked a lot with pediatrics, and so you might do everything in pediatrics. But then if you had a specific musculoskeletal issue, you might refer to a specific musculoskeletal physiotherapist. And so even you're sort of introduced to all of it here, but then as you progress through your career, you might narrow towards one of the others. And one of those might be sport, or might be within that performance context of trying to get the maximum performance you can out of someone. But it might not at all. It might be something completely different.
Yeah. Or they might end up in theatre and and working with people doing movements and circus performing.
Getting
absolutely. a niche down.
Yeah, exactly.
So when I started this degree, I know I said before, I thought I'd get some exercises and give them to people and they would be fixed. And realised that's not the case. They sort of introduced quite early on the biopsychosocial model. And I came to realise how much sort of the psychological side gets is used within rehabilitation, and also how much of like the therapeutic alliance. So how much of that I remember actually throwing. I'm not going to name people and throw them under buses. One of the students sort of said last year at one point, "Why are we asking?" Not to the lecturer. Why are we asking all these questions? I'm not going to be a therapist. Yeah. Sorry, Ed's expression right now is quite picturesque.
Interesting.
And which is So it's, but that's a huge big part of it, is being that sort of counsellor, that therapist, that those ears. I was going to say that voice, but that those ears, the person that's listening and helping to educate and guide and everything else. So, what are your thoughts?
Oh, well, so interesting, isn't it? I think used a phrase which I've heard many times over a few minutes ago, which was about, doing the physio. I'm going to go here to do the physio.
Yeah, I need to do my physio today.
Yeah. And I was like, oh, that's really interesting. So what is the physio? Like, what is the therapy? Where does that happen? And kind of in a similar way, it's like, maybe there's a therapist who interacts with a person and they do something and then they fix that person. Great, job done. Tick. On to the next. And actually, not only is kind of life a lot more complicated than that, but, how people are and how we behave and what causes someone to feel one thing or another, it's going to impact how they can move.
Yeah.
It is complex.
Very.
And actually, there's almost nothing that I can do with my hands that is going to solve whatever's happening with the person I'm working with. And actually, a lot of the time, it's going to be something that person does.
Yeah.
And how do they do that? And then the question is like, so what are the barriers that have arrived in front of that person that prevent them from doing these things?
Yeah.
And if then I'm the therapist, if I'm supposed to be guiding them through that and helping them with that, I need to be adequately equipped to try and help this person navigate those barriers.
Yeah.
And those barriers might come from a lot of different sources.
Yeah.
It might be something to do with how their muscle works, and maybe it is
a biological.
Maybe it's firmly within that silo, but I think that's unlikely, or maybe not as common as you think. I don't know, maybe I'll experience things differently once I'm out in practice, but from the feedback I've got from the clinical educators and other educators, it seems to be that our beliefs, our ideas, our fears, not only affect our engagement with therapeutic practices, but actually affect the condition itself on a physiological level.
Yeah.
So that it's not separate from the thing that's happening, in sort of parentheses, the machine of the body.
Yeah.
It just doesn't actually work like that.
No. The brain's a prediction machine, and it uses past experiences, what it knows, what it expects, to formulate the experience of pain, amongst other things, and create those beliefs. And so, so it's a very complex thing, but also the brain can release, or the brain can send messages to release, is more correct, various chemicals around the body or within the brain that will enhance or move away from certain scenarios. So it can escalate things and make things, just your thoughts can escalate and make things worse, or can actually improve things and make things better. So the psychological side, that I think that's been the biggest surprise for me, is like, as I say, thought I was going to get some exercises to give on a sheet and a pamphlet, do your physio. And in the end, I've been looking at masters in neuroscience, pain neuroscience, and behaviour change, and probably psychology conversion is where I think I'm sort of heading, which is a bit of a surprise because, as I say, thought it was going to just be straight cut. If you've got a dodgy Achilles, do this.
Well, I think something that's really interesting to me personally about that is, it might be right. It might be like, okay, so this is the functional problem, and and I know that these exercises will help, but how are you going to be motivated to do that exercise?
Yeah,
and that is going to be and that's going to be impacted by the things you're talking about. So, like, what is the life you've lived that's led you to this point, and what's your experience of exercise? What else is going on for you? What is those social things as well? Like, so what are you trying to manage in your life right now? Yeah, and where can exercise fit in with that?
Because you can create the best plan in the world, but if someone's not going to follow it,
it's worthless. It doesn't mean anything. And so yes, like, what is our role then? Because it's not my magic hands fixing something.
Is it true that when you have your placements, do you have literally 10 minutes with each person and then that you're on to the next one? Is that a true thing?
So I think this will. So yeah, maybe I can give a bit more detail about the range of different types of placements you might have, and so it's limitations just of time in terms of you're not going to be able to experience everything that's out there, but that's going to change depending on the type of placement you get.
Yeah.
So my first placement, some of these turnovers were really, really quick.
Yeah.
Where, we're just doing a quick. Basically, someone's been determined to be medically fit, and they just need a physiotherapist to kind of see them move, to be able to determine, in sort of layman terms, see them move.
Yeah.
To be able to determine whether, we feel like this person is safe to go home as they are, or actually maybe we need to provide an aid that they can walk with. And some of those, they might happen within 10 minutes. And then other times it might be, this person has a lot of challenges. We really need to get this person out of bed. There are a lot of challenges. It's going to take some time. Could also be on call for respiratory. I think, this person's oxygen saturation has been affected. We think some physiotherapy might help that. Yeah. Stop what you're doing. Yeah. Get here now. And it might only take 5 minutes. It might be something quick. Whereas I think on my next placement, it's going to be a much more organized time slot. Yeah. Where you have this 30 to 40 minute slot. Not ask me in a couple of weeks. I'll tell you how long those slots are. But you have this slot that's allotted to this person, and then your whole, maybe your whole next couple of weeks have already been determined like that. And then you might be in a more, something I've become kind of interested in lately. You might be in a hospice. You might be working in palliative care, and then your routine is going to be very different again. You might be going out in the community. You might be running classes. Yeah. And so how long you have to do that in any given context can be changing. Yeah. I can say that I think, as anyone who's experienced the NHS in this country in the past 10, 15, 20 years, it's however much time it is, it's always pressed. Always, it never feels like enough.
No. So, but it's not necessarily a 10-minute conveyor belt, but it might feel a bit conveyor belty, or.
Well, the context. I definitely, just talking about my own experience, I definitely felt the bed pressure on that first, in that acute environment. There was a real sense of like, we need space for these people, and so we need to try and arrange these things. And then I don't know, you're going to be editing all of this anyway, not to get too political. But interestingly, I was watching some of the Senate debates a couple of weeks ago, and the big topic, like what's going on in the NHS. I think we all feel really palpably how that's changed. Yeah. And there's some interesting discussions about the intricacies of where those issues are, and it's not just within healthcare, but actually the social care side of it is a really big thing as well. Yeah. And that's definitely something I saw is like, okay, X, Y, and Z might be ready for this person to go home, but this other category of care in the social side of things isn't there.
Yeah. So basically, it's like clogging the bottle hole up or whatever. You know, like you it's creating a bottleneck. That's the phrase I'm trying to think of. It's you've kind of got, because one cog in the wheel is not working, then it's putting a spanner in the works for everyone else.
Yeah, and I, and I don't even think it's just that one cog. So like, it's
all the
that effect, but happening in various
Yeah.
different things, and then so you get this kind of exponential backlog, because it's always getting bigger and bigger because there's various different points where those bottlenecks are appearing.
When I was on the Access course, if anyone's a mature learner and you've not been in education for a while, you might have to do a foundation year or an Access course, which generally I think are free. It was free for me anyway. But when I did the Access course, we had to do like a research project, and in that I was looking at the NHS. I can't remember what it is, but like their 20-year plan or whatever. And obviously they were sort of saying that they're going to increase the amount of apprenticeships that are being done. They're going to increase the amount of nurses, the amount of physios. How are the job prospects looking from what you understand as a student and from past students that you spoke to or anyone in the workplace?
Yeah, so I don't have any
data.
official data on this. I've just got purely anecdotal. My own perspective. And there was a kind of word around the campfire conversation a few weeks ago amongst the cohort, which was just like, are there any jobs? It's I think that scope will vary between individuals depending on things like your ability or willingness to relocate, whether you have any specific area of interest. But it seems like, there was this kind of sense of, maybe not as much out there as we thought, particularly in terms of feeding into the NHS. Some of the feedback we've got from some more experienced people, because we're, at the end of the day, we are students. We can only talk about our perspective as students.
You've not experienced attempting to get a job yet. Because,
exactly. We've not been out in the kind of world. And some of the feedback we've got is that that might change year by year.
Yeah.
It might just be 1 year where, they're not featuring in at the moment.
Yeah.
And then next year, suddenly, there's all of these new things available, and you might be adjusting your they talk about bands, different bands of pay basically within the NHS. It's probably some other better definition of what that is, but it's almost like a category. So you've got like categories within the NHS of you've got band 4 up to, is it like band 7 or 8 or whatever, and it's the higher the band you're in, the more pay you have, the more sort of responsibilities, managerial role you kind of and to some extent I think some higher level of expertise or specialism within your field, and I think the idea is that once you've qualified as a physiotherapist on a degree course, you are then eligible to go into a band 5 position. And so what might be the case if there are no band 5 positions available, you might work as a band 4.
Yeah, you've got your degree. But that's the same as any workplace, to be fair. It was always one of those, when I was 20 years ago. So it was, I'm going to get a degree and I'm going to get a really good job. And it was actually, let's manage expectations. Get the degree, get a not so good job, walk hopefully into it because you've got the degree, and then, the graft goes on in the workplace and building up and internal promotions or, moving on to other jobs and opportunities. With the bursary, how does that work? So I was going to say, it's not physio. I believe it was paramedics are in a sort of similar sort of situation. I think it was someone there that I was speaking to.
It was there was an article about it in the BBC.
Oh, okay. I've not seen this.
Yeah, that was just these kind of initiatives here to create healthcare workers within a certain place to fill a demand, and those same people who've been encouraged onto that being told, actually,
you're going to have a job here.
You might want to think about applying abroad.
Okay. So
and that was it's not me. That's the BBC.
Yeah.
Can I mention them?
yeah, you can mention BBC. Everyone mentioned BBC. Yeah, so we'll cite them. We'll put a link in. No, we won't. If I can find it, I'll put the link in the description. Because like one of the things with the physio was I was quite keen to do it as well, thinking, well, the bursary makes it free. I'd have a job for 2 years. So it's like in my head, it meant if there was a bursary and I've got to work for the NHS for 2 years when I finish, that means I've got a job waiting for me.
Yeah, which, might not be the case.
Okay.
But there are lots of stipulations around that bursary and how that works. Lots of small print.
Small sprint.
And I think I could be wrong. I'd have to double check this. Don't sign anything without reading it.
Yeah. You're responsible for your own paperwork.
Yeah. But if you're unable, if you're applying, if you can evidence that you're making all effort to find the work that they're saying is there for you, and you can't find it after sort of X number of attempts, then,
it gets wiped out.
It gets scrapped, yeah.
That's what I've also been told from another source. So,
yeah.
But again, read the small print. Make sure you know what you're signing up for.
And so, so they recognise things like that. And, and there are other stipulations. So, part of the university experience is you might want to get involved with something like a student union.
Yeah.
Where you want to become an elected representative of the students in a paid position.
Okay.
Which is a protected thing amongst universities. You might do that whilst studying and interrupt your course to do it. And that's recognised within the bursary as well. So they recognise that doesn't count as time. That's protected time if you chose to do that during your studies, sort of thing. So, there's a whole bunch of small print stipulations around how that works, about what sort of hours you might put in for the NHS and what can count towards your hours to pay back that time. I think definitely there can be that sense of like, oh, great, I'll do this thing because not only do I get this qualification, but there's a job for me there afterwards.
Yeah, not necessarily.
The world is complex. And so...
There may be, they may not be. So,
or that's the deal, actually, I think, is you're not paying with money. You're paying with an agreement for that time. But there are then stipulations that if they can't provide that back for you, they're not going to...
Yeah, they're not going to come and take your car.
Yeah, exactly. So...
so from a sports injury point of view, again, I've not applied for jobs because I've not got the degree. I think it looks quite promising. Like, I go on sort of LinkedIn and I see a lot of jobs being advertised and stuff. I know that it's very competitive. So like, again, don't quote me on this, but something like for every like physiotherapy, sports injury rehabilitator sort of job in a football club, you're talking of like at least 75 applicants, so it's quite, there's probably football clubs listening to this going, no, we had more than that or less than that or whatever. But as a rough idea, it's, I believe quite heavy and competitive. But, there does seem to be a lot of opportunities out there to pursue. You can also set up as your own private practice. So, there's a few of us that have started doing that, working like myself. I do massage outside of uni. And, I'm not going to lie, it's been a godsend financially. It's like exactly what I needed, exactly when I needed it. If I'd done the physio and not had that massage, and I know like they ran the level 4 as a separate thing last year. But if, so the level 4 in massage, that once you've got that, you can then practice massage as well. That has made, I think I'd have really struggled this year. I think I'd have really had some tough decisions to make if I hadn't had that qualification to fall back on as from a life point of view of going through different life changes at the minute, and just really needed that. So that has been a big, and obviously not every degree is going to have that sort of massage qualification, so it's really worth looking at. Also, like with ours, because ours is linked to the degree, because we did the massage within the degree. If we pass that module, we can practice outside. We can get insured and practice outside. And for the record, insurance doesn't cost a lot. £5 a month, pretty much, I think. It's about what I'm paying. So if you if you qualify, you can practice. But if I was to leave the course now and think, oh, actually, this isn't for me, I would lose my qualification because I'm protected with it through the governing body kind of thing. It's a little bit awkward. So that's why it's like when the level 4 came up last year, I did that as well, just so I had a separate standalone qualification. So I know that actually if things change and I had to leave, that I can still carry on with that and build something in the background. So it's just being worth aware of and looking into it and checking the university out and for your own homework and purposes. But yeah.
Yeah. I think it's interesting. I think it speaks to a little bit about what's a degree for. And, so this is particularly physio. And I guess to say as well, I was talking a lot then about job prospects, specifically within the NHS in Wales. If you're
funding
not
yourself.
on that, if you're funding yourself, a whole other scope of opportunities. And then, and to say after you've done that time with the NHS or for whatever other reason, you win the lottery and you get to pay that off, or you can't find the job and they say, fair enough, you don't know us anything. Yeah, then a whole other world of opportunity opens up, including private practice, your own practice if you want, and everything that comes with that. But I think it sort of raises this question about, what is a degree for? And of course, like in the world we live in, everyone's got to make the dollar, they've got to make bread. So you want a job, but is it, what are you learning this for? What do you want to learn at the same time? I think it's interesting to ask yourself those questions as you're making that decision.
And it can change. So like, as I say, I had in my head I was going to be a clinician and work in private practice, and then you start discussing things and seeing the placements, and you hear the feedback. Like obviously I've not been with the sports club this year, but you get that and you sort of like, I'd like that. Like you start hearing these different stories. It's like, oh, I really like the idea of that. But then you got to take a step back and think, well, does this align with who I am and my interests? And for me, a lot of the time is, no. It's like, this would be really cool for a month. And then I'd be pulling my hair out and wanting to do something else. So what's been the biggest surprise with you and your direction for where you want to go?
Yeah, good question. I mean, I guess I've sort of already done that by being here at all from my last life, to some extent. But I think that kind of happens. It depends who you are. Yeah, I think different people. Some people can sort of latch onto something and be like, "This is my thing," and then that's it for the rest of their lives, and they're quite happy to do that. Or you might pursue a myriad of interests throughout your life. That might happen. Like me.
Change every 2 years.
And that's okay as well. Like if you can make that path kind of work for yourself. And I think, for me, so I was kind of really, coming from this artistic background and then arriving on this course, and I was thinking, okay, they're going to show me some really methodical, scientific ways of thinking about the body. And it was like, oh, it's this complex thing where there's so much more, or these other complex factors to it, which I was already interested in anyway. So that was a kind of a surprise, but it was a really welcome surprise. And I think for me, sort of pursuing that, or areas of physio that might allow you to think about the complexity of your thoughts, feelings, beliefs, and how that impacts your physiology, and how we can, in different ways we could intervene with that and kind of motivate and encourage people. I think it's definitely my interest, particularly around, I didn't know that there was a whole specialism around chronic pain. And how do we help people with chronic pain? And that's definitely become an interest of mine.
So they do the pain neuroscience masters in, it's new this year at Oxford, so that's one I was looking at. But I feel like there's too much, there seems to be lots of what and so what's and not enough now what's. So I want to do more now what with my life, and like, let's take all this knowledge that's already there and let's put it into practice, which is funny because we said about research. And I'm aware of time, so we will start wrapping up. So from the sort of research perspective, so you were sort of saying, like, before we started getting the cameras rolling, mics rolling, saying about like research is what makes it a bachelor's.
Yeah. So, because I remember this from my first degree, when they were like, because my first degree, again, it was sort of fairly practical. I was looking at performance, and but they were like, but you have to write a dissertation, because that's what you're saying. To say you have a degree, you need to be able to recognize what is evidence, critique it, understand it, and then possibly, produce some of it yourself.
Yeah.
And that's kind of like, there are known rigorous processes within that around, something like the scientific method as a really broad example of, create conditions that are largely controlled and be able to test a hypothesis. And that might be one way of doing research that's going to produce a certain kind of knowledge, which has its limitations and strengths.
Yeah.
And you need to be, to say that you have a bachelor's degree, you need to be aware of what that is and how that works, and be able to engage with that yourself to some degree. Yeah. And it's particularly relevant to healthcare now, because, where do we get all our healthcare ideas from? Yeah. Well, from the best evidence that we can produce around it. And that's how medicine has managed to evolve in the way that it has to be what it is today, is from having or implementing those processes. Yeah. And so, that's what that research then is really about. Yeah. Which lots of people have different feelings around. Yeah. Different levels of engagement.
Yeah. Just a bit.
But at minimum, just being able to understand. Yeah. That, me saying, well, I knew someone who smoked their whole life and then nothing ever happened to them. Yeah. Yeah. Doesn't count as evidence for anything. Yeah. That's just something that I saw. Yeah. Which could mean a whole bunch of other things. Yeah. Like it could be.
I had a wild night and drank like about a third of a bottle of whiskey. Do not recommend. In fairness, I was all right the next day. But I was just going to say, I got up the next morning. My body battery on Garmin was 100. It hasn't been 100 in ages. Oh, wow. So it's like, if you take that on its own, it's like, this is evidence that no, we're not going down that route. It is looking at the wider evidence, the scientific evidence of things. Don't drink whiskey to get a body battery of 100. It can happen. Probably won't.
What? So it's a great example to use. So like, have you taken account for all of the other things that may have caused you to have a body battery of 100? So you drank the whiskey, but was it what the whiskey was doing to your body, or was it the social interaction that you had at the same time?
Or the numbing effect.
Was it? Well, was it something that happened the day before? Yeah.
Was it a faulty watch?
Was it a faulty watch? Exactly. Watch. So how do you create those experimental conditions to be able to, as close as you can, verify whether that's true or not? And and this is just with one person.
Yeah, and we're all physiologically different.
There's
and if I drank it, if I did it again tonight, shall I do it again tonight?
Well,
if I did it again tonight, would it be the same result tomorrow? Probably not.
Yeah, so then a different person, and could you compare what had changed between tonight and the previous night? And so so like it seems like a flippant example, but it's like it's a real real thing. Yeah, so
couldn't do that in a lab. I've really enjoyed the research. I say I don't remember really doing it when we did like art and design. I mean, we must have done, but I think it was more like we were researching for our projects and things. Like looking at designs that had already been done rather than reading through studies and then knowing how to cite and put names with dates and stuff, and then every uni tends to have its own version of referencing, how to write out the references. So let's finish off with your we'll do top 3 tips. Top 3 tips for students going into physiotherapy. I'll do mine and you can see if you agree with any and can add any on.
All right.
So tip 1, learn your anatomy and start early. I did this with flashcards on Anki. So learn your anatomy, your origins, insertions, what muscle goes where, what bone goes where, origins and insertions. Agree?
Yeah.
Yeah. Oh,
Yeah.
that's not that convincing though. I'm not quite convinced.
No, yeah, I do agree. I guess so. My following tip then, I
Okay.
guess, in that kind of way, would be it's not all about anatomy.
Yes. Yeah. No, good one.
But like holding them both absolutely in importance. Yeah. So like, think about a musician or a pianist. Yeah. When they're learning their craft, you have to do your scales, which are a little bit boring and methodical. Knowing, this is this, and then you do that in order to then make music, which is something else completely, which is a more fluid, creative process. And I think you can maybe think of it a little bit like that. So like, yeah, you've got to do your scales. You should spend some time using whatever method works for you, learning that anatomy and getting that down. But then remember that's in order to serve another process, which is about working with a person.
Yeah.
And how you communicate.
Oh, yeah.
How do you listen? How do you understand what they're saying and be able to do that? And then how do you kind of interpret that into an idea of what might help them? And then how do you communicate that back to them in an effective way? And that process is where the actual, or maybe is closer to where the actual, in parentheses, where the physio happens. Yeah. And so, yes, absolutely learn your anatomy.
But learn to communicate.
In order to do something else.
Yeah. I suppose knowing what's broken doesn't necessarily mean that it's fixed.
Yeah. And knowing what's broken and knowing the series of exercises of how to fix it doesn't necessarily translate to that happening in the world. And that. Yeah. What are the other things you need to do to be able to do that? And just being, at minimum, being curious and mindful. Yeah. That exists and that's a fundamental part of the process. That alone, I think, can go a long way to helping you develop those skills.
Yeah. And then I suppose last tip from me would be to invest yourself in being surprised. So I suppose like you said about staying curious, like I know I didn't mention it and I was going to, is we did like a sports psychology module. And it's probably actually been my favourite module in the whole degree, because that surprised me because I never studied psychology, and we did it in Access, and I enjoyed it then, but I found it a little bit heavy, learning all the different types of psychology and stuff. So it was a lot more applied the way that we learnt it this year. Just be prepared to be surprised and invest your time and energy in learning new things. Like, something might not look on paper like it's something you want to do, but give it a try. What's the worst that can happen? The more you get out there and try things you don't expect to like, the more you'll either surprise yourself or confirm, actually, this is the direction I want to go. So, any more tips? Oh, are we done?
I don't know, look after yourself.
Don't drink the third bottle of whiskey. In
not
one
too
go.
Often, anyway.
So thank you very much, Ed, for coming along and participating. We'll have to do this again sometime. It's been great fun, despite hiccups getting into the room. But we broke in, don't worry. So thank you very much. Thank you very much, everyone, for listening. Hopefully this will make it clearer whether sort of the strictly MSK, musculoskeletal route, is for you with sports injury rehabilitation. And you can always do the physiotherapy masters if you still want that title. So it is still a route available to you. Or whether you want to get the title of the physiotherapist in the degree, learn about the cardio and neuro side as well. Probably end up in the NHS if you're on the bursary, or you could end up in private practice or anywhere. You can still get that pitch side route. So thank you very much. Take care. Crack on.